stavudine and diadenosine are not part of our selected antiretrovirals that we use in Ghana. They are not part of any of our regimen. So we are lucky. But in case any of these are used, as for stavudine, it's together with stavudine or diadenosine. Then there is high risk of pancreatitis, liver problems, and peripheral neuropathy. Note that this drug on its own, it is able to suppress your bone marrow. It causes myelosuppression. So if you are to take it together with other drugs with similar effect, then you are only worsening the possibility of myelosuppression. So asparaginase, afatinib, azathioprine, all these agents can cause myelosuppression. So giving them concomitantly with hydroxyurea may cause massive myelosuppression. So these are some of the issues. Now, what are some of the counseling points? Adherence is very important, else you are not getting the results. So you need to hit the patient hard on adherence. The drug has the possibility to reduce your WBC and platelet. And therefore, it's not surprising to see that it causes or it puts the patient at risk of infections and bleeding. Platelets, bleeding. So low platelets, bleeding, low WBC, infections. Of course, it's an anti-metabolite. So we don't want you to be handling the drug anyhow. It has a lot of problems. So you wash your hands before and after handling the drug. So this, of course, is applicable to the healthcare professionals as well, not only the patients, pharmacists, nurses, doctors. If you handle it, you should be careful. Don't open the capsule, please. If you open the capsule, then you are creating more chance to take the drug or get the drug absorbed into you, not knowing. Of course, an anti-metabolite agent can have issues with protein synthesis and therefore possible issues with reproduction. And therefore, if you're on it, then you should be cancelled on reproduction. It can cause sunburns and therefore unnecessary exposure to sunlight must be avoided. These are simple counseling points. So in your exam, if you get a case on SCD and in case hydroxyurea was used as part of your counseling, you must make sure that you state some of these. This is what your examiners will be looking for as part of the counseling on the use of hydroxyurea. Any queries?
Hello, sir.
Any queries? Yeah, hello.
Yes, please, with the hydroxyurea and the extemporaneous preparation, I've seen some facilities that open the capsule up to actually formulate it in the liquid form. Now you are saying with the handling, they shouldn't open. So what's the best way to get the extemporaneous preparation?
No, you are not getting it. You see, yes, we don't have the liquid preparation. So if it becomes necessary that a child who cannot swallow the capsule needs it, then of course, the manufacturing guys, they are also experts in their own field. We have compounding pharmacists. They know all the safety precautions and whatever, and therefore, they can open it and convert it to liquid preparations. But if you are not part of them, maybe you are the patient, you are the maybe doctor, pharmacist just dispensing the drug, or you are the relative, then you go opening the capsules. We are telling you that don't do that. But if it happens that we are to prepare the liquid form from the capsule, then that one you have to do, but you must be cautious. We are not saying that don't open it at all. No, in cases of converting the capsule to liquid preparation, yes, it is allowed, but you do it with caution so that you don't get the drug attacking your hands and then having any access into your body.
By the
Are you
place
okay?
open. Is the place open?
Hello.
Did you ask her what
So
place
the
is the
capsule
place?
should not be open here. We are not talking about when you are converting, you are preparing
The
the
mortar.
extempo forms. No, no. This one is in reference to those using the drug. You are an adult.
So you can
You
let
say that, hey, I can't swallow the capsule. So on your own, you
because
open
previously
it
they can attempt to
into
open
some
it, but
liquid
it's
and no,
always
no, that.
open.
And then maybe you are the mother. So you go and buy the capsule and no. Remember, it has reproductive
In the
consequences
process,
and other
before.
side effects. So you should be careful.
If
But
you
the
if you
expert,
want
the
to bring it
compounding
out, you can
pharmacist and the
swallow.
compounding team, yes, they do it. But they also must observe all the possibility of safety
But I hope
issues.
you've been learning the whole day.
And they must, of course, they will have the protective
I'm
gears
asking
to avoid direct contact. You in the
yes.
house, you will not have any protective gear. You open it, it gets stuck on your hands, and you are in trouble. Please, are you okay?
I'm telling you something else. I have a
Yes,
question.
please. I'm okay.
It's about doing
But it
calculation.
looks like that's not what is
It's
done
a
in
car.
the hospitals. That's why I was asking.
1,000
The one I know.
So what have you been
for
observing
those
in the
days.
Okay,
hospitals?
You
so
understand?
just as I said, they get the mortar
So
and
prove it out.
pestle, then they open the capsules up,
I'm also going for a
pour
driving
the
test.
powder into the mortar, add their
That is
other
also
um, components to it.
Excipient. And they prepare.
mine is
They don't even
Yes,
do it
please.
under the
six
Ivy
six.
hood.
No,
They
please.
don't. So like the
Where?
open place, like the preparation room, they may even be in their normal uniforms, as in their
Y-
shirts. The one
Yes.
I will check because I'm the one
yes,
preparing
in the
the.
hospital we do a whole lot of things. But
Nothing,
ideally,
nothing, nothing.
Okay.
it's not supposed to be done because you are exposing yourself
No,
to
I'm not the
harmful
one doing
effects.
anything.
You are not supposed to
Okay.
do that. We do, and mind you, especially when we get to the law, ethics, and policies, there are so many things that we do within the hospital that are not in line with the either the
One
law,
second,
the
I'm just going to
act,
talk
or
into it.
the all the
I'm just going to talk
recommendations, the
into it.
guidelines. So many things that we do. For example, when we even fill the dangerous drug book, it's supposed to be something that we should do before we even hand the drug over to the patient or the nurse or whatever. But normally, we will give this drug, we will not even complete it until the day that those drugs are almost out of stock.
Nah,
Then we go back and check the records. Then we try and then fill
Matty,
the dangerous drug book
Matty.
because we are now going to the pharmacy stores for more stock. But it's against the law. It is something that you should do before you even hand the drug over to whoever is going to use it. But you don't. So don't always take what you see at the hospital as the standard. You need to double check before.
God, this is
Most
lovely, 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 lovely.
often we even do shortcuts. That is, at times we improvise. That is not the same trouble. So imagine if you are before the panel and you are asked, how do you prepare the liquid preparation of hydroxyurea from the capsule? Then you start your narration. Oh, you just take mortar and pestle and then.
For pharmacies
You
people,
see that thing?
thank you.
So
Yeah.
I'll check
please,
on my own. If you want me
yeah, just note all the things, but make sure that you check
to be fully
for
knowledgeable.
confirmation if that is the right thing to do. Trust me, most of the things that we do, all of us we do, are wrong. You serve prescriptions and you cancel the prescription. Is that not so? If you fully serve, have you been doing that?
Yes, please.
That is against the law. Nobody has asked you to cancel any legal document. It is wrong. But all of us, even today, I'm going to cancel some. I don't know why I can't stop doing that. Like I feel better if I cancel it, but it's against the law. If you are done dispensing, you just write you the dispenser, your name, the date of dispensing, and your address on the prescription form. Then you keep it for at least 2 years. Nobody has asked you to cancel it. But all of us, the moment we finish serving it, with speed, and the way we will just increase the speed, sing, yes, we are done. That is wrong. So there are so many things that we are doing that are not right. Always make sure you check, especially going to the exam. You don't take those things there. You verify.
Love
All
one.
right, let's continue.
I know the
Now,
book.
Okay. Please,
Part two.
please, I have a second
Example.
question.
okay.
Yeah. Please, with the hydroxyurea, even when the patient is doing well, is there a particular age um, a patient can take, or once he's doing well, he can continue for life?
Yes. So it's like for chronic management. You see that thing. So
Okay.
you give, you monitor against toxicity
Okay.
because we always want to build up HBF. You see that thing. So it's a
Yes.
chronic. It's part of chronic management.
Okay.
Now it's part of the government program. They provide hand. It's supposed to be free. I don't know if people, but at times intermittent shortages and those
The one
things
in the corner,
will be creating a lot of problems. So we are hoping that we can get consistent supply with that. If it's free, everybody is happy. If those guys are not getting vaso-occlusions, we are happy. Nobody will come and worry us with acute chest syndrome and the rest. All right. Now, generally, how do you do chronic management? So let's look at the approach. All those ones were acute management, but chronic management, like in the case of using hydroxyurea as part of the chronic management, what do we do? So the first step, you confirm the presence of SCD. So you have confirmed the presence of SCD, and therefore you enroll the person on the SCD register. So the person will be coming for SCD clinic. So yes, so the hematology guys will be doing this. Now, you need to also cancel because this thing is normally detected in childhood. If you are a sickle cell person, it will be detected in childhood. If it is not detected early, your chances of getting to adulthood is very slim. You may die before you get to adulthood because it must be detected and controlled promptly. So, of course, your mother, your father, your sister, or whatever will also be there. So, it's not only you, they must also, your caregiver, and then you, the patient, must receive education about the condition, its management, how it happens, and whatever, and counseling. So that's the first thing: confirmation, education, and counseling. Then you begin clinical management, antimicrobial prophylaxis for obvious reasons. The person is not immunocompetent. Spleen issues, functional spleen issues. We have issues with immunity. Then we have to protect the patient from a lot of infections. In Ghana, for example, malaria. Malaria is a problem because we have a lot of issues with malaria. So all forms of prophylaxis, be it drugs to prevent the malaria or any other infection, vaccine preventable infectious conditions, we must make sure that the patient is covered. But again, from 2 months of age, we initiate penicillin as part of the prophylaxis against infections. Infections like encapsulated organisms, very stubborn, and therefore we must protect the patient against. So from 2 months up to 5 years of age, by that time the patient's immunity may be okay. So after 5 years, we may abort the continuous use of penicillin V. We may abort. Then increase demand of folic acid, of course. Once you are stepping up production of RBCs, you need protein synthesis, and that automatically will increase the demand for folic acid. So we need it. So folic acid, 1 year to adulthood, you initiate folic acid from 1 year to adulthood as part of the step one management. Of course, as I said, as part of the protection, ensure that the patient has received all the vaccines that are needed for vaccine preventable infections. So pneumococcal vaccine, meningococcal vaccine, the pentavalent, all those things. In Ghana, of course, expanded program on immunization will cover most of these things. Ensure that the patient, the child has received all the appropriate vaccines as per the guidelines of the expanded program on immunization. Then educate the caregiver on danger signs, especially danger signs of vaso-occlusive crisis, fever, sign of infections and inflammation, pain, pallor, all these are danger signs pointing towards the possibility of hyperhemolysis, vaso-occlusive crisis, and what have you. Splenic enlargement, an indication of splenic sequestration or what you should know. Then importance of dehydration and therefore hydration as a key agent in managing this patient. So basically, step one, this is the things that you do. Confirming the condition, educating the patient and then the caregivers and counseling them. Trying to protect the patient from infections, be it oral antibiotic prophylaxis or vaccines. You have to do it. And making sure that as part of the education, you give the patient all the danger signs and symptoms pointing towards vaso-occlusive crisis and the complications that may arise from vaso-occlusive crisis. What again? Step two, monitor the growth, nutrition, spleen size. Of course, you realize that in childhood, it affects how they even grow. They don't grow as according to our expectations. So you monitor the growth, nutrition, spleen size, FBC panel, reticulocyte count. So of course, this means that you have to be visiting the clinic every now and then because you can't do this in the house. You go there, then the clinician will write lab requests for you to go and do so that he or she will be able to monitor most of these things. By 9 months, you are free to initiate hydroxyurea. So it means that 9 months is when you initiate to adulthood. So your target, of course, especially when you realize that you have high levels of HBSS or even HBSC, the severe forms. How do you know that even HBSC is becoming severe? Either HBSS or HBSC, and the patient suffers or experiences 3 or more pain events within a year. So it means that it's not only HBSS that we can give hydroxyurea, even those with HBSC. The moment either you are HBSS or HBSC, then we realize that within 1 year, you have experienced 3 or more painful events, and you have history of